Welcome to Community Connection. I'm Iowa City Mayor Bruce Teague. The impact of COVID-19 is touching every corner of our community, and this show is dedicated to highlighting the efforts of the organizations working to protect people. Many groups in Iowa City are rising to the occasion, finding ways to overcome obstacles during this pandemic. Today, we are going to be highlighting the efforts of the Refugee and Immigrant Association. I'm joined by Executive Director Jean Paul Mugemuzi. Thanks for joining me.
Yeah, you're welcome.
I'm so excited to talk to you today. Seemed
Yeah,
like just yesterday we were doing a webinar together where we
yeah.
were where we were navigating some of the concerns that your community that your organization has. And so today I'm happy to have you on the show and just to talk about what's happening within your world. And so I know that there's a lot of history with the Refugee and the Immigrant Association, and some of the people that are maybe watching today, they may not know what your organization does. Can you tell us a little bit about what you all do?
The organization that we do pretty much is about like educating our people, the refugee and immigrant community. Educating them, and then you know uh, we do some issue awareness, let people know what is going around, and connect people with you know the the local communities in both Iowa City and Cedar Rapids, and then to be able to help them, navigate, help them understand the culture, and help them do stuff in Iowa City and Cedar Rapids. Yeah, that's pretty much that we do that to connect people with, especially Americans, and to be able to raise some issues, so that they may know what is going on, something like that. Yeah, that's pretty much that we do, and it happens that sometimes we do help people with the support them with financially. Yeah, but pretty much that we do that to educate our people.
John Paul, how long have you been within the United States and where did you come from?
Yeah, I came from Congo. I've been in the United States. I think now it's like more than 7 years now, and I've been in Iowa City since 2015. At the time I moved to Iowa City.
So what I know from some of my friends that are immigrants that have moved here, the culture is very different here in America. So things that they're accustomed to back home, it may not be the same thing that they're experiencing here. So when we're in this crisis of a pandemic, the coronavirus, and so I imagine that there are some barriers that they're facing. One, when it comes to the pandemic and how can they navigate that. But some of these individuals are probably still newer to our community and they're trying to adjust and learn the culture here. So, what are some of the experiences that you're finding during this time, isolated from the pandemic, but then combined with the pandemic?
Yeah, as you said, no matter the life is totally different from back home to here. So everything with everyone, when you get to this country, you are new, so you have to learn like almost everything, and especially those people who didn't go to school. People cannot, when you get here, you cannot even speak the language, so you have to learn every single thing. And it took a lot of time people to adjust. It's not like, because when you say like someone who is new, so you may be maybe 1 year or 2 years, and you can catch things very quickly than someone who's been in 5 years. It just depends with where you are from, because we have like some people who are refugees who came like from South Africa. So South Africa in Africa is a country who is like who is like a developed country, you can say that, because they are far with the technology, so they don't have like to learn a lot of things than people who came like from Tanzania, people who came like from Uganda, something like that. So It depends. And those people who came like from South Africa, most of them they can speak even a little English. But when we have like people from refugee camp like Tanzania, refugee camp like Uganda, most of them they don't even speak English. Some come from a refugee camp in Burundi, so they don't speak English. And when they get here, so they have to learn every single thing, and then it took a lot of time for people to understand it. And especially in this time, I would say like it's so difficult for people to to adjust, with this social, yeah, it's the isolation. So it's just like everything is new. Life is new. Everything we are just like almost all of us. We are just like learning because we are getting in a very new system of of living. So we find like people are having like having issues of paying like bills. You have like the bills like from the electricity, you have to pay like the water, something like that. So people they used to go to the office and pay straight, the bills. But now with this social isolation, people they have like a to send like the check to send like a through mail, something like that. So people they getting behind of paying those those bills, something like that. All those things are like issues that people they are that they are having. You see, like some of the parents they have children who are going to school. Some of them they don't even know that there is the classes that is going on online. You know, and they are the children are at home. They don't know anything that is going on. And then when you talk to other people are, are learning online. Other people they are not learning online because they don't know, how they can do that. All those are like issues people are going through. So in this situation, like it's not easy.
Well,
Yeah.
I do know that you all are trying to bridge that communication gap with those that need to know that there is online learning, as well as educating on what the coronavirus is and what does it mean to safe social distance. We were on a webinar, you and I was on the panel, and we were having discussions surrounding some of these similar topics. What I did know is that your organization is really trying to help navigate that communication with those in the community. I can only imagine what it's like to be in America, especially if you're new and you're trying to navigate some of the online learning, which is probably not in your first language, as well as trying to navigate the health system if you have concerns about the coronavirus and getting a test. I've traveled out of the world to other countries, and I'll tell you when I go somewhere where they don't speak English as the primary language, it's a little challenging to kind of navigate a little bit, but I tend to find someone within that community that speaks English, whether it's a restaurant or a hotel. Typically, I can find someone that speaks English. But here in America, where our refugees and immigrants within the hospital setting or within the school system, some of those their first language is hard to find for them at times. I did understand that the hospital, University of Iowa specifically, you can get someone to interpret in your preferred language. So that was one good thing that we did learn. But one of the things that I know that your organization is really doing is working with individuals to help with that communication on school, ensuring that they have some resources, as well as the coronavirus, which I do want to talk a little bit about that. What does it look like when someone gives a call? Are you all giving are there resources online that they can go to in their language to find out essentially about the symptoms of coronavirus? We talk about temperatures, if it's 100 degrees or higher. We talk about that social distancing. But again, what does that mean to be 6 feet or more apart? And we also talk about hand washing. And I think you were the one that brought up, people leaving their house with those gloves on, and they go all around and then they come back with the same gloves on. So there needs to be some training and some teaching there. So, talk a little bit about what your agency is doing with some of this communication and the barriers that many of the individuals that you work with. Talk about some of those barriers and how you all are overcoming that.
Yeah. So the communication, as you said, this is like the key point, and this is among the reason that this association was created. Yeah, because before, so we used to take like people to different medical appointments. So we just like take someone, but you are not an interpreter. And then when you get there, you find that at the hospital they have their own interpreter, someone who's going to interpret for the client. And then when you get there, so you are there, and the person, maybe I would say like someone from Kenya who's going to interpret someone from Congo or Burundi. And then when they speak the Swahili is a little bit different. So and you can speak English, so you will see that the thing that the patient is talking and the thing that the interpreter is telling the doctor is completely different. Completely different. So now from there, so we did understand that there is a problem that need to be resolved, and is among the issue that led us to create this association so that we can be able to provide like the service that is needed. And as you said, the communication is it has been like something like a very important, especially at this time. And from this situation, we did find out that it was better for us to have a refugee and immigrant newspaper, so that we can be able, if there is anything new that's going on, we can write in the newspaper and be able to deliver, by a home delivery, so that people they can be able to get the information on time. That's what we are working on, and then from there we are saying thanks to the Johnson County Foundation that have accepted our grant request, so they did give us some money, was going to allow us to start this this newspaper, which is very good. That we do really do what we can do. So I think you will be maybe surprised if I can tell you that right now we are busy than before. You can ask yourself, how are you going to be busy and everything is shut down? How are you going
Sure.
to be busy than before? Yeah. So we are busy because people are calling too much, and we feel like we have also the responsibility to call people to know how people are, how they are doing. So every single day we have to make sure that we are calling different, community leaders. You have to call someone like among the leaders from Sudan. You have to call someone among the leaders from Burundi, from Rwanda, something like that, so that we can, make sure you are connected with these, different refugees and immigrant community in the city. You have to know how they are doing. If there is any issue, you can be able to discuss and see if there is a way you can help, how you can be able to help. As you said, with different things, and then you see people, they are more afraid, to face someone who's wearing a mask than someone who doesn't have a mask on, because for them, when they see someone they must say, oh, this person is sick. That means if I pass close to this person, I'm going to be contaminated. So without knowing that the one who does have a mask on, that person cannot contaminate someone, because the mask is preventing someone to pass the virus to someone else. So people, they feel like they are okay being next to someone who doesn't have the mask on than being, you know, close to someone who does not have a mask on. So which is very dangerous. Because the one who doesn't have the mask on, that person is very easy, to pass the virus to someone else than the one who doesn't have the mask on. So all those things that people they have to know, and to understand about those things, so that they can feel like comfortable being close to someone who does have the mask. And people, they should know why they should be putting the mask on. All the things. Yeah, we are just trying to teach our people, let them know what is going on. And that this issue is like something like it is like the health thing. So even ourselves, before we can give like such information, we have to make sure that the information is right. So before you can pass it, so you have to make sure that you did talk to someone who is in the field, who can tell you that, okay, yeah, this is like this. Then you can be able to pass the message to the community, something like that. Yeah, that's why I say that you are so busy, talking to the community, trying to find someone who's in the health department, that can give like the right information. Then you can be able to pass the information to the community members. Yeah.
One of the things that I've been inundated with as an elected official is the request to ensure that there is communication in various languages so that people can understand the coronavirus and the precautionary steps to take, definitely explaining why one should wear a mask. And that's what you all are doing a great job at communicating. I refer people to your organization so that they can have some of those conversations within their own language. There are resources through your website as well as through our city website in various languages. But again, it sometimes you can read what you read and your interpretation may be different. But it's also nice to have someone that can communicate with you in your own language so that you have this dialogue that you can kind of just talk things out and ensure that you have a great understanding. So you do bring up some great points when you're talking about the mask and the fear that one might have when they see someone on it with a mask on. But that wearing of the mask is to protect them, to protect others essentially from, as well as someone else wearing a mask, is to protect them. And so you do bring up an interesting point there. One thing I did want to talk about is when we're looking at the nation and how Black people are, when we're looking at the virus numbers and how they're impacted, it's not even. We're seeing this proportionate rate of Black people being affected by the coronavirus in various ways, even death. And so that's where it becomes crucial for the information to be passed along so that people understand the importance of what's happening. I think we're privileged to speak English because we can turn on any news station and they're talking about the coronavirus. They're explaining it to us over and over and over. Some people are getting tired of hearing about it. But we're having that dialogue and understanding what the governor orders mean. But for people where English isn't their first language, sometimes even if they speak English, their interpretation or understanding may not be fully that of the message that's been sent. And so one of the things that I've enjoyed about just knowing what your organization do is making sure that people do have the practical skills related to understanding what's happening with the coronavirus. Again, I'll never forget when you talked about wearing the gloves and needing demonstrations there on how to wear gloves. Even hand washing, that's one of my pet peeves when people wash their hands and they turn the water on and they get it all soap and they're singing, they're doing their 2 birthday songs through, and then once they're done, they go and turn off the faucet with their clean hands. And so are you doing any practical things even through conversation with individuals that call in?
Yes, yes, we are doing that. Yeah, we are letting people know about all those things. Yeah, and what you talked about like washing hands. So after the webinar, so some people they called us and they told me, so why you didn't tell the mayor about the raise of the price of the water, because now people are washing hands all the time, and then people they are doing too much laundry because when you go out with the clothes, when you come back, especially at work, when you come back, so you have to wash the clothes straight. So people they are doing too much laundry, so that means that people they're using a lot of water and then a lot of electricity. And they say, why did you let the mayor know that the price of the electricity and the water is going up. So they should know that there is something going on. I said, no, I didn't think about that, and say maybe when I get the chance to talk to him, I'll let him know. Yeah. So people are, going through like a different things, and yeah, we are letting people know how they can, they can practice all those things, how they can put like the gloves on, and then how they can use the glove. Not take the gloves and then say think that you are secure. You go to Walmart and then come back again with the same gloves. So they have to know when they can put them on, then what time they have to take it off, and how they can take it off.
I think really to change at least the disproportionate rates within our community is education. And
Yeah.
so, and that demonstration of simple things like wearing gloves and washing your hands and how you turn off the faucet, you know. So, and you do bring up an interesting point about increase in utilities because people are washing their hands more is what we want and what we hope for. And they're also washing their clothes when more often now. One of the questions that I do have is related to what are you seeing as far as the financial impacts of people that you serve? Are they are you finding that there's a lot of unemployed people or just a mixture of all of that? Are people able to collect any unemployment? What are you finding within your community?
In terms of unemployment, people, because there's some places that are closed, and so I'm not sure how things are going with the unemployment, because when they tell like a place like Tyson is when they shut down place like a Tama and Amana, Wellpool. So you have to know that we have like a lot of people are working there. So that means that we have like a lot of people who are staying home at this time. Now we they are trying to call and see, okay, if they'll be they'll be paid. Some companies they say, okay, they'll be paid, and some people are going through like a unemployment system. So which is like they have like a lot of people, so they have to wait. Some people they are calling the number that they were given. Some people will not get the answer, something like that. So people are still waiting and see what is going to happen. Yeah, but financially, like a lot of people, they are affected. That's for sure.
And I think this is something we're learning. We may be here a while where coronavirus is going to be sticking around and some things may be opening up within our community per the governor's orders. If people are returning back to work and to doing various things within the community, I believe it's going to be important for organizations like yours to really educate on, yes, things are being opened up, but how should people conduct themselves and to keep themselves protected to the best of their ability. And so we're going to certainly be looking towards your organization to do some of that hands-on type training to ensure that everybody is protected to the best of their abilities. Now, one of the questions that I have for you is related to you all do a lot with the communications and you have your website that people can go to and kind of navigate some of these resources that's available to them. But if there's someone watching this today that says they want to support your efforts, how can they get in touch with you all if they want to do a donation?
Yeah. Yeah. Before I can answer to that question, maybe I would like to mention something, because when you said like about like communication, uh, especially like people who does not speak, people don't speak English. That for sure, it's so hard. Even for people who do speak English, because we have to understand that there is a trust between someone who's giving the information and someone who's receiving the information. So people they have to understand that the way uh, I'm giving the information to my community, the way they will receive it is going to be maybe different from the way you can give it and the way they will receive it. You know, as when I'm talking to my community, people they trust, they believe what I'm talking that is true. Than when they are talking to someone who is not part of that community. So people they pretend to think that maybe is not like serious. And this is why with this this situation going on, you see that at the beginning, many people from Africa, they were not, they didn't believe that the virus could, catch everyone. People, they were thinking maybe that people from Africa, they went through a lot and said, oh, maybe this virus is not for us. This virus is only for America, you know. So they have, but when they see like some people who was positive from their own community, and then we did talk to those people and then tell them, okay, to have the courage of talking to other people, to let other people know. And this is what, if you can go to our Facebook page, you see that we have a lady from Africa who was positive. And then she made, a small video to let other people know that, okay, I'm young and then I'm from Africa. So, and I was positive. So meaning that even African can catch it. Yeah. So coming back to the question that everyone who like to donate. So if, as you said, if you can go to our website, you see that we have like the PayPal. If people would like to donate on PayPal, and then if you want to write the check, you can just write a check on the Refugee and Immigrant Association, and the address is 1566 South Gilbert Street, Iowa City, and the zip code is 52240. That's our address. Yeah.
Well,
So
great.
anyone would like to write a check and do that.
Well, the work that you all are doing really is very impactful within our community. I know that, again, even today, I got requests to kind of explain what is the coronavirus, what are some of the symptoms, as well as just what are the things that's going to happen in the future as far as like opening up of the states and what that means for, the health of individuals. And so, of course, I don't have all those answers, but just the simple question of what is the coronavirus and how do I navigate it? And it was for someone that doesn't speak English. And so how can they get that information? And again, that's why I believe that it's very vital for your organization to exist, because there's a resource that I can turn them to where they can receive some, communication. I thank you all for all that you're doing, because I do believe that in order for us to really ensure that people understand the seriousness of it, it's going to be going to your Facebook and hearing it from someone within their community, someone like from Africa that can say, this happened to me. We need you to take this serious, because there's a lot of us that think we're invisible and this won't happen to us. Like you said, it's happening to those other people, but it can happen to all of us. And so in order for us to really get through this and be in this together, there has to be communication given to all segments of the Iowa City community. And so, again, thank you for being a part of that messaging center that reaches a particular part of our community. So thank you for doing that. Is there anything else you would like to say today?
Yeah, the thing that I would like to say, maybe you did touch it. So when you say like you see like the black communities, we have like the rate of people are affected like is high. I think this is something that uh, should be a main concern, you know, for all of us, so that we can understand why this happening. And then if you see everything is telling about communication, people getting like the information on the right time, and people that they don't follow like the news, and then people they don't read and all those things. This is why something we end up by being caught by stuff that we don't even know when it starts, while other people they know it ahead. And yeah, and I will say that it's something that we are working on too. See how these things are going to end up. So we are trying to see if we can make like a community committee, which is going like we are going to have like a different leaders from different community, and we can have like a a committee that will be meeting with, like the city government sometime and then talk, just like a talk, which is not going to be like an event or presentation, but just to be able to meet with, the city, leaders, and you can be able just to sit down, maybe, exchange ideas and see how our community can get involved and see how can be able to get the information at the right time. That's what we are thinking about, about doing. See if we can be able to fill up this gap. Yeah.
Well, I'll tell you that your organization has had a great reputation with our city long before I was even
Yes.
an
Yes.
elected official. So, not worried there about the partnership that needs to continue here. And
Yeah.
you're exactly right. Leaders can help that communication go across various segments. Very happy that our Mayor Pro Tem Mazahir Salih has been out, and she's a champion at trying to ensure that people are getting the communication with the language that they have. We've also had our other counselor that speaks French, Counselor Janice Weiner. She has
Yeah.
also been out there navigating. She can speak to some of the ones that you serve.
Yeah. Yeah. Yeah.
And
Yeah.
so
Yeah.
we're doing what we can from
Yes.
our area, and our other counselors have even been doing Facebook messaging out there to ensure that they do what they can to kind of spread the word. So
Yes.
I think we're in a great place in Iowa City. In order
Yes.
for us to get beyond where we are today, again, it's going to take all of us working together. You already
Yes.
know that.
Yes. Yeah. And that's why we are so proud, of you guys. You are doing a very, very good job. So we feel we are so supported by the city of Iowa City. We are so
Great,
supported. Yeah.
great.
Yeah. Yeah. You do care about us. So I'm so happy, so proud
Well,
of you. Yeah.
well, thank you so much for joining me today. I really appreciate it.
Thank you very much for having me.
You can follow along with city resources and updates by heading to our website at icgov.org/coronavirus. I'll be back again on Thursday with another community connection. We'll be meeting with Mercy Iowa City Hospitals. Until then, remember to do your part. We're all in this together. Be safe, Iowa City.